Next on Sisterhood of the Second Act.
10,000 people turn 65 every day, and with that comes the eligibility to apply for Medicare. It's not the easiest process, and your decision as to which plan to go with could cost you. Cheryl Crawford with J.M. Ford & Associates is here to help us understand how the Medicare system works. And as we age, our metabolism slows, but there are ways to give it a boost. Holly Fields is a certified personal trainer and a certified fitness nutrition specialist. She's here to teach us how we can master our metabolism. We'll meet these women on this edition of Sisterhood of the Second Act right after this.
I'm gonna be an oak tree.
I think I'll be a dogwood tree.
My kids said they'd be looking for a thorny tree for me.
With Evergreen, you can be a tree. Our biodegradable urn combines your ashes, natural soil additives, and a native tree of your choice. Be a tree and grow for tomorrow.
I want to be a tree.
Learn more at evergreenmemorialtrust.com.
In Bedford County, Virginia, discover local wineries, breweries, cideries, and even a meadery. Each venue has its own unique vibe. Enjoy fun and games, or relax on a spacious deck with mountain views. Download the Bottled in Bedford Craft Beverage Trail map and sample happiness in every pour.
Get your map at bottledinbedford.com.
Now from the Fox Radio Roanoke studios, this is Sisterhood of the Second Act.
Welcome to Sisterhood of the Second Act. I'm Denise Allen Membreno. Are you or someone you know turning 65? Well, that means you may be eligible for Medicare. And if you are confused by the alphabet of Medicare plans, you're not alone. And those commercials you see on TV, they may not apply to you or to where you live. Here to lead us out of the cloud of confusion is Cheryl Crawford with J.M. Ford & Associates. And Cheryl, thank you so much for coming in today.
Thank you for having me, Denise.
And I know you have a lot to get to, so let's just jump right in. What is Medicare and who's eligible for it?
Medicare was designed by the federal government and enacted in 1965, and it is for people who are age 65 and over, and it's since then the benefits have been extended to people with disabilities and people with end-stage renal disease. So today, though, we'll talk about the folks who are gearing up for 65 and those who are already in that threshold. So Medicare can be confusing, lots of letters. And let's think about it like this. Part A is your hospital insurance for when you're in the hospital as an inpatient. Part B is for your medical insurance, working with doctors, and when you're an outpatient, basically. Now, in 2006, they added Part D, and the way I remember that is D is for drugs, so it's for the prescription drug plans. And then there's Part C, and that's what we hear a lot about, and that's Medicare Advantage. That's one of the options, an optional way that you can take your Medicare insurance, your Medicare benefits, and we'll dive into that just a little bit later because there's a lot to get to there.
Yeah, there's a lot to get to everywhere. Thank you very much for the simple breakdown. So now exactly where, when someone nearing 65 should start with Medicare.
Right. It's a good time to think about it. And you know, I like to say instead of the early bird getting the worm, the early bird is the prepared one who knows what's going on. Because most people think they can just turn 65 and then all of a sudden they have their Medicare insurance. And unfortunately, that's not the case, but the government gives us the design of being able to be an early bird and prepare 3 months before our birthday or birth month, and then 3 months after that. So as long as you are prepared, know what you're going to get, and you've worked with a Medicare specialist, as long as you do that before the end of the month before your birth month, you'll be able to start your benefits when you're 65. The only thing there is if your birthday is on the first of the month, they look at that as being as the month before. So you can just go ahead and kind of count out on the calendar 4 months if your birthday is the first of the month. So there are, so that's part of the win. The other part of the win is a lot of people ask, well, what if I want to work past 65? And most folks in our lifetime, they are working past 65. And so that's where we look to say, are you still working with a company that has 20 employees or more, and you are covered by their group health plan? And if you are, then you're going to want to stay there. If you're not, that's something that you'll need to discuss with someone and make sure that you're prepared for that as well. When that happens, they'll help to get you some paperwork on their side, knowing that you're going to be leaving them, and it'll set you up to go ahead and be able to pick your insurance. Now, you'll have about 8 months after you decide to stop working. Most people want to go ahead and get started.
Yeah.
So the where in that part, Denise, comes up with, well, where do I get my card? That's a question that I think people know, but they really have questions about it. So if they're already taking Social Security, the government will have them taken care of with that, because they'll be getting their Medicare card in the mail about 100 days or so before they turn 65. The question really comes in, so they're set, right? So the question really comes in, what if I'm not taking Social Security? You may still be working, not taking Social Security, or you're just not taking it yet. So for those people who want to start their Medicare plan at 65, they'll need to go ahead and get on SSA.gov, Social Security Administration.gov. If they have not already created an account, they'll want to create an account there, and then go to SSA.gov/Medicare and sign up there. They may also want to have a choice of just calling the Social Security office or going down to the local office.
Okay. And we are talking with Cheryl Crawford. She's an independent health insurance broker. We're talking about Medicare. Okay, so I've decided when I want to start Medicare, and I've gotten my Medicare card. How do I know what I'm signing up for? That's a big one.
Denise, that is the biggest question, because education is the key here. You do need to do a little homework before you actually go and meet with a Medicare specialist. So let's go back to what I talked about before. We're going to look at original Medicare, what the government set up to begin with. So Part A, it's hospital insurance, and that helps to cover the inpatient hospital stays, the skilled nursing care, the hospice care if needed, and home health care. Now, it's important to note here, because people will get this confused sometimes with long-term care. When we say skilled nursing care, that's meant for you if you've had an injury or an illness to go to that skilled nursing center and be able to work with their therapist and get better and eventually go home. Mm-hmm. So it's also important to know, Denise, that Part A really comes at no charge or a $0 premium for most folks. And here's why. We've been given in our paychecks really all the time that we've been working. So if we have been working for 40 quarters or 10 years, either you or your spouse, then you're qualified for that $0 premium with Part A. Now, Part B is the medical insurance that we talked about before, and that is services from doctors and other healthcare providers, outpatient care, home health care, durable medical equipment like wheelchairs, walkers, those types of things, and many preventative services like screenings and shots, yearly wellness visits. So the Part B monthly premium is $164.90. Now, if you're a high income earner, that's a good thing, yet you will have to pay a little bit more for your Part B premium. So together, let's look at what we just talked about. Together, Parts A and B cover 80% of the charges that you'll have in hospital care, hospital stays, and your medical coverage. The federal government was never set up to be the sole payor on the Medicare. So there's no cap, though. Here's the problem. There's no cap to that extra 20% that's left open by the 80% that they pay. And so we're going to talk a little bit more about what to do with that. Before we do, we've got to talk about prescription drug plans. And that's real quick, but they help to cover the cost of prescription drugs that you get at the pharmacy, the ones that you either get going to pick it up yourself or the ones that you have through mail. They're run by private insurance companies, and they're only contracted for a calendar year, which is really good because they have a lot of changes that go on within the medicines that we take. So a couple things. We talked about a high income earner. You might have more to pay. You may also have more to pay in addition to your Part B here at your Part D. And then the other thing to remember, Denise, is if we don't sign up for Part B and D at the time that we need to, you may have to pay a penalty that'll last the entire lifetime of the plans, which is actually your entire lifetime.
Oh my goodness.
Yes, true. So let's look at our choices. Well, number one choice is we can decide not to do anything. Not a good choice. The other two choices that we have, and the things that they have in common, these other two choices, the things that they have in common is that you have to be enrolled in Part A and Part B. And that's about the only thing they have in common. We're going to talk about the differences here. So staying with traditional Medicare, let's start there because we understand a little bit about that right now. So with traditional Medicare, there are no networks, there's no HMO, no PPO, which means that you can go to any doctor anywhere who accepts Medicare and they will go ahead and pay their 80% and then your supplement company will go ahead and pay its 20%. Medicare only pays for 100% of preventative care services. So again, they don't pick up that and it creates gaps. And that's what we're looking at. So we're talking about adding a supplemental plan, which is also known as a Medigap plan to cover those gaps. They create financial liabilities for us, and we really don't want that. What we're doing if we decide to take a supplemental plan is we are giving the risk to the insurance company, and they're getting from us a monthly premium. And so that works with that plan with A and B. You're adding the supplement, and then you're also going to get what we call a standalone drug plan in this plan. So we're talking about staying with traditional Medicare, using your Parts A and B and getting a Medigap plan, a supplement plan to fill in those gaps. In addition to that, we'll want to add a Part D prescription drug plan. That will come from possibly the same insurance company, maybe a different one. It'll be a standalone plan with a separate premium, and you'll pay that each month as well. So we are going to talk about the other option, Part C, known as Medicare Advantage plans or replacement plans for traditional Medicare. Now, what happens there is a private insurance company that of your choice, you will give the control of your Part A and Part B to them. They'll manage your care. That's why it's called a managed care network. You'll still have Parts A and B, and you'll still pay your Part B premium. They'll have a series of networks that you'll need to use, an HMO, a health maintenance organization, and that'll be a fairly small network close to home. That's why we want to know about the zip codes. Or you'll get a PPO, a preferred provider organization, and that's a somewhat larger network, and you'll have a little bit more freedom and choice there, but you may have a little bit more to pay there too. Some of them are as low though as a $0 premium. And you hear that a lot on TV as well. So there's a series of co-pays that happen within a Medicare Advantage plan, and it goes towards a maximum out-of-pocket expense. And so they kind of take track every time that you go to the doctor and you're paying a copay, and they're tracking that into the maximum out-of-pocket. It's kind of a pay-as-you-go system here. Prescription drug plans are actually embedded within these plans. And again, it's important to pay attention to those plans because you want to make sure that it works with the drugs that you're taking. The other part that you probably heard on TV, you actually get options of dental, vision, and hearing and other benefits. So we're going to summarize. First, let's start with Advantage plans. They are network plans. They are copay based. They're a pay-as-you-go system. They may require pre-authorizations for certain surgeries or doctor's care. There are healthcare services that your doctor does not have the final say-so. So it'll have to be the insurance company who says, yes, you can have that, or no, you cannot. Traditional Medicare, on the other hand, as we discussed, is premium-based. There are no networks and no pre-authorizations. So if the doctor says you need it and Medicare approves, then they will cover it as well as your supplement. Now, Denise, a lot of people ask about switching plans. And it's very important. This is one of those things that you want to make sure that you understand before you sign up for a plan. So when you sign up for a supplement plan, again, using that with traditional Medicare, when you are first eligible for Medicare, you have a 6-month period to be able to get one of these plans. Now, let's clarify and say first eligible when you're turning 65, or if you are still working when you're very first moving into Medicare and coming off your group plan. So the insurance company at this point in time must accept you into a supplemental plan without any questions asked about your health, like pre-existing conditions. It's guaranteed issue. That is what happens in this period. It's a guaranteed issue. Now, if you make any switches later on, you would need to qualify, and they have the right to ask to have you underwritten, and you may or may not pass based on your health. Medicare Advantage, if you choose that plan, the good thing about those is there's no underwriting, and you can move from plan to plan when you have that opportunity. People think they can just switch back and forth, and that's sadly not the case. It will depend on your health. And we do see a lot of people making those mistakes at first, and so it's so important to figure that out. The insurance companies at this point have the right to decline you.
Okay, wow. That is a lot of information. We are talking with Cheryl Crawford. She's an independent broker with J.M. Ford and Associates. So as we mentioned in the introduction, those commercials that you see on TV, what does a person with Medicare coverage need to know about them or need to show?
That's very important, because they are trying to make sure that you don't miss time frames. And the one that you'll hear the most about is starting October 15th, and it runs through December 7th. And that's the time that you can change your Medicare Advantage plan and your prescription drug plan. So an easy way to think about that in thinking about the parts, Part A and Part B, you don't change. Part C and Part D, you have the option to change. And this is a time that you want to gather the medicines that you're taking and figure out if you'll be taking them next year and decide what you're looking for in a plan. It's also the time to see about if there's another network that you need to go to within the Medicare Advantage plan, or something else might trigger something that you're really looking for. The open enrollment period is January 1st through March 31st, and that is a time specifically for Medicare Advantage plans. You may make a change there, or you may be able to first time enroll there. So that's also an important time to understand that you have decisions to make. So the third one that you may hear is a special enrollment period. And that is, like we talked about, if you are leaving your position at work and making a move, but also making a move within counties, within states. That's a time for a special election period. You may not hear them as much on TV, but you may hear them from people that you know.
You are an independent broker, so why is it important to find someone like yourself, an independent broker, when you're weeding through Medicare?
Well, I'll tell you what, Denise, there are so many nuances, as we've just briefly discussed. And it's important that a beneficiary understands what they need and really comes prepared to understand that. And what we can do as brokers, because we represent most of the major carriers and many of the plans, we're able to put things side by side for them to understand which might be best and help them make the decision that's going to be the best one for them and their pocketbook. Also, people don't realize, but our services do not cost anything for them. We are compensated by the insurance company, so don't think you do-it-yourselfers out there that if you did it yourself, you're going to save some money. They will take care of paying us. Let's get you taken care of.
Okay, that sounds great. Thank you so much, Cheryl, for being with us today.
Thank you, Denise.
And we will have Cheryl's contact information in today's show notes at sisterhoodofthesecondact.com. Coming up, getting older doesn't mean your metabolism has to grind to a halt. How to rev up your metabolism right after this.
In Bedford County, Virginia, discover local wineries, breweries, cideries, and even a meadery. Each venue has its own unique vibe. Enjoy fun and games, or relax on a spacious deck with mountain views. Download the Bottled in Bedford Craft Beverage Trail map and sample happiness in every pour.
Get your map at bottledinbedford.com. Once again from the Fox Radio Roanoke Studios, Sisterhood of the Second Act.
Welcome to Sisterhood of the Second Act. I'm Denise Allen Membrano. Many of us gain weight as we age, and sometimes we blame our slowing metabolism, but that doesn't have to be the case. Holly Fields is a certified personal trainer as well as a certified fitness nutrition specialist, and she's working on her PhD in health education and promotion. And she's here to help us rev up our metabolism. Holly, thank you so much for coming in today.
Thank you.
I really appreciate it. I mentioned your background in the introduction. Why is this something that you wanted to do?
Oh my goodness. Well, my whole, obviously, 3 decades have been related to fitness and health. And actually, it's crazy how I got started, because I actually started in college majoring in psychology. And about 2 semesters in, I was like, I'm not sure this is really what I want to do. And I actually had to take a wellness class. And one of the segments of that was strength training. And I don't know what happened. Like, went to this little weight room down in the bottom of Peters Hall at Radford University, and I loved it. And I just thought it was amazing how strong I felt. I'd always been like a little skinny kid. You know, I'd always been athletic, but never really any muscle. And so, I don't know, something in that changed me. I just changed my whole major and ended up in what's now exercise science. So, just love that portion of it.
So we're here today to talk about metabolism because I saw an article that you had written, and I would love to speed up my metabolism. I'm 58, going to be 59, notice some things. So first of all, tell us, what is a metabolism?
So your metabolism, in simple terms, it's really the chemical process of breaking down food to convert it to energy for your body, like all of your bodily processes. So that's basically consisting of 4 different things. And that is going to be your resting metabolic rate, your exercise, your NEAT, which is non-exercise activity thermogenesis, and then also the thermic effect of food. So all of those components are sort of what make up your metabolism. And if you think back to resting metabolic rate, that's just how fast you are going to process things at rest, not doing anything but just surviving, laying down, doing nothing, right? So everybody's got different levels, right? So you can't really change what is inherently given to you
By genetics.
Right. So I think that the thing that people need to understand is that you can improve your metabolism. And a lot of people feel they can't, and they refer to aging as, well, I'm old now, my metabolism has slowed down, I can't do anything about it, but you actually can.
And so that brings us, I saw in that article, bad news, good news, and better news.
Yeah.
So what is each category there?
Well, so the bad news is you were genetically predispositioned to be a certain way. The good news is you don't have to stay that way. The even better news is that you're not losing everything as you age if you put the right things into play as you age. Typically, somebody thinking their metabolism slows down as they age is really due to the 2 main factors of losing muscle and lack of activity. Think about when you were a little kid, right? And you're always active. Did you have a problem then? Probably not. Typically, as we age, we do less. You're fighting the battle of losing muscle as well as you age. So especially past the age of 40, every year you're losing muscle. So if you put those 2 things together, you're losing muscle, plus you're not doing anything. That's the problem.
And you mentioned the resting metabolism. So if you have more muscle, your resting metabolism is higher.
Exactly.
So you kind of touched on it there. What does age have to do with the slowing metabolism? Just that loss of activity and muscle?
Right. So sarcopenia is the loss of muscle. and that happens as we age, right? So every year you're losing a little bit more. If you're not doing anything to keep that muscle active and stimulated, you're kind of having a double whammy, right? So by strength training, you're actually, I always tell people, you know, that think they're going to get big, like, look, I'm 51 years old now, and I kind of lift as heavy as I can. It's really just to keep what I have. You know, you're not, past a certain age, you're not going to get big. You don't have that ability. So think about, you're losing muscle. So lifting's not going to get you way up here at bodybuilder level, because you're kind of fighting against that.
And it takes a lot of time to get to that bodybuilder
Well, it
level.
takes tons of heavy lifting. Right, I do that too. And it is hard, and every year it gets harder because your body is losing muscle. So it's really hard to keep the muscle that you have, but you're probably bodybuilder level, you've got to not only have that muscle stimulation in place, which is heavy, it's very dedicated over time. It's a surplus of calories. Most people don't have that either. So it takes years.
But with that said, you can still build muscle as you age.
Oh, yes, absolutely. And we want to do that. You want to keep that muscle active, not only to, you know, have the shape you want, but also to like prevent injury. It keeps you healthier long term. It helps you live longer.
And we are talking with Holly Fields. She's a certified personal trainer and a certified fitness nutritionist. We're talking about speeding up our metabolism. So what are some ways, proven ways, that we can speed up our metabolism?
So obviously muscle is a big one. You know, like I said, we're starting with the resting metabolic rate. So very first thing you need to do is stimulate muscle growth, right? So lifting weights and heavy weights. It can't be, I tell ladies, if you're lifting weights that are lighter than your purse, it's probably not going to help you, right? So you need to train your muscles to be challenged. That's going to improve your resting metabolic rate. It's going to help you use your calories more efficiently, and it's going to help you be stronger long term.
What if someone doesn't like high intensity workouts, or is not physically able to do those workouts? What can they do?
So when I think of high intensity, I kind of think of a lot of jumping. Running is high intensity, right? I mean, I'm not a runner. You don't have to do super high intensity. It doesn't have to be thing like, there's a lot of HIIT workouts, right? Mm-hmm. I've had clients come to me who have done high intensity training for so long, they've actually gotten themselves into a really bad place metabolically on the other side, right? So there is a time and a place for that, but you don't have to do those to still gain lean muscle and support your body and help reduce help reduce like chronic diseases. That's another thing that muscle is going to prevent. You don't have to do that.
No, that's good news for a lot of people. So what role does diet play?
So when I was talking about the components that kind of influence your metabolism, and one of those is thermic effect of food, right? Protein is the highest thermic effect of any of the macronutrients. So basically your macros are fats, carbohydrates, and proteins. So proteins are going to be very important because they do have that higher thermic effect. So if someone is trying to reduce their body fat, protein is going to be really, really important, even if they weren't lifting weights. But if you lift weights as well, that's going to help in all of your muscle repair, your lean muscle building. So food makes a really big difference in your body composition. And a lot of people think it's just about calories, but it's totally not. It's got to be the right breakdown of calories as well. Again, you're supporting that lean muscle growth. You're supporting your body structure by eating the right foods. Also, your micronutrients are going to be what gives you amazing energy and helps you feel better overall.
Wow, that's really interesting, and I'll make sure that we put the link to that article that I mentioned in today's show notes. So one thing that's really underrated in our society is sleep. So how does that help your metabolism?
So think about, a lot of people think, I have to live in the gym to make any progress, right? But actually you're making the progress when you sleep. So lack of sleep is really inhibiting your goals. So the thing is, not everybody needs the exact same amount. Typically 7 to 9 hours is best for most, but some people only get like 4 or 5. So if you think about, if you are lacking sleep, the next day you typically don't make the best food choices. You tend to have more cravings, because what happens when you sleep is your hormones reset. Okay, so we've got several things that are happening in sleep, but your hormones reset. Therefore, the next day, you're able to make good choices. You can usually stick to your nutrition goals better, and you don't have these cravings. A lot of times people don't connect the two, but again, with recovery, when you sleep, that's when your muscles are actually repairing. So you're not improving your body in the gym. You're improving your body when you rest and recover, because that's when your muscles are healing. So if you don't get adequate sleep, you're really shortchanging yourself.
Yeah, I think a lot of people need to hear that. When someone starts a new program like this, what should they do?
Well, so it depends on their goals, really. So there are so many pieces of the puzzle that I myself as a coach, I would look at. So I'm not just looking at, here's a fitness program, because number one, everybody's different, right? You have pre-existing injuries, you have health issues that you're dealing with, you have things that you can't do. So it shouldn't just be a pick anything out of the clear blue sky program, right? It needs to be something that's going to work for you. It needs to be something that you like. You know, if somebody hates running, why would I tell them to run? You know, there are so many ways that you can get in better shape and be healthier. But a lot of, in addition to the workouts, you know, you have to think about your nutrition. You have to think about your sleep. You have to think about stress management. You know, there's so many pieces when you want to do a program. So, I mean, I would think the first place to start would be to get information. And we were talking earlier, I think the easiest way to do that is to have a coach who can help you, because it helps you sort through all of the mess that's out there and all of the confusion from all of the things you read.
And that was going to be my next question, is why to choose a coach. Holly, thank you so much for coming in today. I really appreciate it. And we will have Holly's contact information in today's show notes at sisterhoodofthesecond.com. We'll be back to wrap up the show right after this.
I'm going to be an oak tree.
I think I'll be a dogwood tree.
My kids said they be looking for a thorny tree for me.
With Evergreen, you can be a tree. Our biodegradable urn combines your ashes, natural soil additives, and a native tree of your choice. Be a tree and grow for tomorrow.
I want to be a tree.
Learn more at evergreenmemorialtrust.com.
I would like to thank Cheryl Crawford and Holly Fields for joining us today. Cheryl helped us understand the ABCs and Ds of Medicare. And you can find a link to Holly's Master Your Metabolism guide on our website at sisterhoodofthesecond.com. I'm Denise Allen Membrano. We'll see you next week on another edition of Sisterhood of the Second Act.